Now for some news across the nation, back here in the States, there are only 2 weeks left to enroll in Obamacare to avoid a tax penalty. So far, California's state exchange, Covered California, has had more success than the federal exchanges, but the final numbers may tell a much different story. We get more on this from KUSI's Steve Bosch.
1.1 million Californians had their insurance policies canceled last year. Less than that, 920,000, have enrolled in Covered California. But not all of them are insured because they haven't paid their premiums yet.
Aside from the Medi-Cal population, it doesn't really look like California, let alone the nation, have really improved the number of uninsured into the insured market.
In fact, the number of insured has gone down. And 85% of those who are newly insured will be getting subsidies.
The bad news is the more people who sign up that get subsidies, the more tax dollars.
Covered California has to be self-sufficient for Obamacare to work in California. We are not there, and not likely to be there on March 31st when the enrollment period ends. We don't have enough young people enrolling to cover the cost of the older, sicker folks.
We know that Covered California is behind the 8 ball in Latino enrollment, and they're still behind the 8 ball in the younger enrollment.
Dr. Ted Mazur of the County Medical Society says it is critical for both of these groups to enroll in Covered California to expand the premium pool of money.
Those populations in general are lower users of health care. The Latino workers in California generally don't access as much health care. They're a healthier population.
If these groups choose to pay the $95 penalty tax rather than paying a higher premium for health care, everybody who isn't getting a subsidy will pay more.
The mix of people on the exchange is critically important because if you don't get a lot of the healthier, younger people, that's Latino and non-Latino, then you are going to have a problem keeping the premiums down. Unless you get the young healthies enrolled, the premiums have to go up.
Californians from Sacramento to Salinas to San Diego will have equal access to quality health insurance.
Covered California has already spent over $100 million on marketing, and just under half of that was directed at Latinos, who are 60% of the uninsured, yet only 22% have enrolled.
Time is really running short. There's only 2 weeks from today to get signed up.
Those who sign up by the end of this month will have coverage starting May 1st. Those who don't will have to pay that penalty tax. Steve Bosch, KUSI News.